On set with me now is Dr. Marc Siegel. I want to bring in our Fox News medical correspondent. Dr. Siegel, you have some information on the people who've been taken to hospitals. And there's a huge curiosity point because, you know, we know that there were 78 passengers, 5 crew on the train. And then we learn on the ground there were quite a few people who were injured. So it would make sense that you'd have upwards of 70 people going to hospital transports. Couldn't quite do the numbers if they all came from the train, but that wasn't the case. What have you learned?
Well, first of all, the hospitals in the area, Tacoma General, St. Joseph's, and also Madigan Army Hospital, they're level 2 trauma centers, meaning that's just a shade below general surgeons being on the premises 24/7. They're easily going to be able to gear up and bring in top doctors. Now, I want people there, our viewers, to know that Seattle, which is 50 miles away, is the #1 emergency services in the country. #1. They've done the most studies. They've looked at how to respond to these things. It's only 50 miles away. If they need to, they can transport patients up to Seattle. But they have Seattle doctors who trained there working at Tacoma, so that they're going to get a lot of great care. Now, I also want to talk, Harris, about what happens inside a train car, because there's been a huge debate now for years. Should there be seatbelts on trains?
Should there be?
Well, I think there should be. But again, you know, when an accident like this occurs, that's when I start to look right, because without the seatbelts, if the train is going 81 miles an hour, the kind of injuries you're going to see are people flying through the air, hitting their head, damaging their spine, and fractures. This is what you're going to see. And I hate to say this for the faint of heart out there, but we're talking head injuries, spinal cord injuries, and fractures. That's what they're going to be dealing with at these hospitals.
Well, not to mention that one of the cars went off the overpass at some rate of speed. We know it was going 81.1 miles per hour just moments before this crash, but at some portion of that conserved energy flew off that overpass and hit that interstate down below. And then you had cars overturned and semi-trucks overturned as well.
And those are going to be an additional number of undetermined injuries. But of course, if you're in a car and a car is a capsule, you can't necessarily escape it in the amount of time that you would like to. You may not. You know, people tend to freeze in this situation. You don't know what's happening to you. A train comes from above, and if you get hit and you're stuck in that car, you can again have compression injury from the car itself collapsing, metal injuries. We're going to see internal wounds from this. We're going to see protruding metal in wounds. This is a big handful for trauma surgeons. But again, what they're going to do on the scene here is stabilize people on boards to keep their spine stable. That's what
we saw a lot of those boards, and they were in different colors that were all lined up along the triage area.
Exactly.
You see, let's look at the screen right here, Doctor. You know, this is a huge semi-vehicle that had been kind of parked for a while. You see it's carrying a huge load of wood. They had kind of kept some things in place while they got people out of the way. They had to move a lot of cars and other trucks and things where people had been injured. And now we start to see the putting back, if you will, a little bit of normality as they clear the roadway even more. But the scene remains. They are pulling now the fatalities off those trains. We were told by Pierce County Sheriff's Officer that they would leave those bodies on and first attend to all the survivors.
Harris, I'm concerned about bystanders, but I want to point out here that the far greater injuries, and this is what we're learning, the far greater number of injuries occurred to the people on the trains, over 70.
Can you talk to me a little bit? So we're talking about no seatbelts, but also, and I had read this, and we've had experts tell us the last couple of hours that there are not the kind of overhead bin capacities that close the way that some trains have, like especially in Europe. So people might have been sitting with objects. Everything becomes a projectile inside that train. You
know, you just made an excellent point, because not just sitting with projectiles, the bins themselves clearly open up on impact, and luggage flies out and hits people.
If you're in a train that even has that capacity, some of them are open bins. You know, you and I take the Acela sometimes down, so some of those things are open, right? Not everything has a latch close on it, so you can get more people, more things in there.
Luggage is flying through the air. People are flying through the air. As you pointed out also, there's 2 impacts. After it flies over the overpass and hits below, there's a second impact. People are going to have crush injuries and head injuries, and what I'm mostly concerned about, spinal cord injuries. Those are the ones you can't recover from. Fractures can be healed. People will be brought to the operating room. Physicians will be coming down from Seattle. That
information you gave about Seattle, though, being
#1 in the country.
#1 in the country for trauma is hugely important. And you've got Joint Base Lewis McChord with its Madigan facility there, who's taken some of the, they've taken 20 of the patients here. So there is a lot of trauma help around this area.
And we know they're trained for combat injuries, so the Army Hospital is hugely important here.
Amen to that. Dr. Marc Siegel, thank you very much.
Harris.
Appreciate you bringing in your expertise on this, too.